Well, when I was a kid, you know, dental working was very embryonic, if you like. It appeared to me. I had a dentist called Dr. McEldowney, and all he used to say to me was, "Open wider, wider," and come at me with these pincers. And as a child, I didn't like the dentist at all. And then I sort of grew up, and I avoided the dentist when I shouldn't have done. We should all go and have dental surgery and regular checkups and everything else. But, you know, I was frightened of the dentist, and as I became an adult, I could make my own decisions, and I decided not to go to the dentist. How stupid is that? But that's what I did. And of course, as a young man, my teeth were fine, always fine. I convinced myself that I had strong teeth, you know, that I was a good human that had a very strong jaw bones and everything else, and I'd be fine. And I'll keep brushing my teeth though. Brush, no problem at all. And they looked fine. Over the years, the back ones maybe had a hole or two, but I put up with the pain. You know, I'll do all that. I went for 1 or 2 fillings, and I maintained a little bit. But overall, you know, I ignored it. I dealt with the pain. When a tooth cracked, I dealt with the pain. I just went on because my front teeth were always very good. If I smiled, no one could see the back of my mouth ever. So all my front teeth and everything else were absolutely fine. And I held on to this belief that I didn't need to do anything to my teeth. Everything was fine. When my company first started to come up with the great idea of designing dental practices, and I fought against that myself because I didn't want to be put in a position. I was avoiding the dentist. I spent my life, when other people went off to the dentist and say, "Oh, I hope it's not too, yeah, I've got a dental appointment." I thought, well, lucky you know, knowing that my mouth was hiding all sorts of things that the dentist I was talking to would be horrified about, or telling me get in that chair rather than design my reception area for me. But nevertheless, I carried on until, you know, obviously I need to do something about it. When I first walked to OPG Centre and walked up the steps as a patient for the first time, I was full of trepidation as to what the reaction was going to be to what I knew was my dreadful mouth. But no, I was welcomed with open arms and, "Chris, please sit down." And so I'm waiting, you know, I'm thinking, oh my God, now I'm waiting. When is it my turn, you know? And before long, "Could Chris Pike please come to room number 3? And I'm thinking, oh my God, it's me now. Now I am really a patient. The doctors, the dentists, absolute professionals, you know you're in the best possible hands. They're taking care of you all the way through. The nurses around are taking care of you all the way through. And you feel that care constantly. But I've had an all-in-4 in the top jaw, which is all my teeth have been replaced in the top jaw. And I've got a bridge and 2 further implants in the bottom jaw that give me a full set of wonderful teeth. They don't feel false in any way. They are my teeth. 6 months later, after 3 visits, it's all complete, and I can move around my work, my social life, with absolute confidence. And instead of hiding a smile, I'm beaming a smile. I'm thinking, look, don't smile too much, for crying out loud, you're showing off now. And eating anything at all, it's amazing how when you've got difficulties with your teeth, you anticipate when you have that piece of steak or that bit of gristle, you know, that's going to be a bit difficult, and you move food around in your mouth to accommodate the areas of your mouth you know are quite tender, or you know, and you end up chewing on one side of your mouth maybe where you know you've got really good teeth or healthier teeth than the ones on the other side. And you're always accommodating the weaknesses you know you have until, as I say, at the end of 6 months, you have total confidence in eating anything at all. Before, I used to have to hide. My smile could only be a partial smile. I used to go to dental awards ceremonies in the Hilton Hotel or the Dorchester Hotel in the middle of London, surrounded by all these amazing dental awards people. You know, there would be all these glamorous women that were dental nurses, but they were dressed up in their finery for the night to accept this award and that award. And there I'd be in the dental awards with my fellow people within my company, most of whom they were younger than me, so they would have better teeth than me anyway. But I remember one day, one of my salespeople said, "Right, Chris, have a look at your smile. Let's have a look at you." And I smiled, and he said, "All right, don't smile too much." And I thought, well, great. No, thanks a lot at the beginning of the evening. So, but yeah, I mean, that was a constant thing in my job, you know, and I used to avoid, I said, don't invite me to the design awards, the dental awards this year. I don't want to go. Why not, Chris? I don't like the food. Again, I'm making excuses all the time why I don't want to be somewhere. When I have meetings now with dental surgeons and dental practitioners, I mean, a lot of them, the closest ones that I know, they noticed, obviously, as Chris, what have you done? And then, of course, I tell them exactly. He said, okay, so you've had implantology. Where did you have that done? Dentum in Croatia, really? And what technology do they use? And I tell them the type of implants they use. So do I, really? And so they've noticed. And they keep asking me, how's it going? Are you happy with the treatment and everything else? They're amazed at the price. They say, well, we couldn't possibly do it to that. How do they do it for that price? So confidence with my clients, confidence with my social life has really come to the fore, yeah. But, you know, it's not without a smile here and there. And yeah, things are looking pretty good on social fronts in all sorts of ways.